Hey guys, my name's Sam and welcome to Prep Medic. Today we're going to be talking about the medical kit that I keep in my car. Alright guys, today's video, like I said, we're going to be going over my car kit. Now this kit right now is also serving as my third line gear for the ERT team until I get some of my other gear in the mail ASAP, budgets being what they are. I'm not quite sure when that's coming in, so this is what I'm using in the meantime. But moreover, this is the kit that I just have in my car all the time. I'm not doing anything super fancy with it, just in case I come across something or a member of my team gets hurt or sick during training. So first off, on this pack, I've got my trauma shears on the outside of the pack. I've got another pair inside because these have a habit of falling out, but I find this is a pretty convenient spot for the initial pair. In this top packet here, got a set of flex cuffs, some gloves, headlamp. This is a Petzl, it's a pretty old headlamp. Now in this top pocket, I keep all of those there simply to have easy access to them. I might not want to dig through the entire pack to get a set of gloves per se, or to find my headlamp, which I might not even be using in a medical scenario. It's just a useful thing to have close at hand. And then the flex cuffs, you know, like we talked about in the scene size up video, scene safety. So if you are treating a combative patient or somebody you've just arrested, you want to make sure that they're restrained and that you as the provider are safe. In this front larger pocket, I keep all the main life-saving gear. So this is your airway, breathing, circulation. First up in this compartment on the side, let me move these things out of the way. I've got hyphen chest seals, twin pack, and then another hyphen chest seal in there. I have an ARS, a decompression needle. Really only carry these if you're actually trained to use them. And then a quick burn dressing that can be wetted down and used in severe burns. On this side of the pack, I've got a bunch, I guess I got 3, North American Rescue Estoril gauze for packing a junctional site. In this pocket, I've got 2 large trauma dressings, ETDs, emergency trauma dressings, the 6-inch versions from North American Rescue. Pretty multi-use, good for either securing in your packed gauze or for wrapping an injury that doesn't necessarily need a tourniquet. And then this top pocket here, I've got 2 tourniquets. I've got the cat tourniquet. I left it in the wrapper just because this isn't the first kit I'm going to for a tourniquet. I've got 2 others in my car, so I want to keep this one as unweathered as possible. And then I have a SWAT tee as a backup to the cat tourniquet. Like I said, I've got 2 other tourniquets in the car, so this isn't my only source of tourniquets, and I usually do carry more on me, especially in a kit such as this. All right, in the third main pocket, I've got diagnostic equipment as well as comfort equipment. So in this pocket here, I've got comfort items. One eye shield if there's an eye injury. I've got some Benadryl, aspirin, ibuprofen, and Tylenol in here, as well as a triple antibiotic ointment and some bacitracin, along with some gauze and some Band-Aids, your minor wound care items. And you know, I found this really useful at trainings. You know, if somebody gets a headache, it's easy just to pull this out and give it to them, or a Band-Aid. It's pretty embarrassing if you're a medic or doing a medical operation and somebody comes up and asks for a Band-Aid, and that's the one thing you don't have. So just a comfort kit here. I've got some eye flushes, just normal saline to rinse out somebody's eyes. Hand warmers, great in the winter, especially in Iowa. Come summer, I'll probably take these out of my pack just to save space and weight, but they're a great thing to have In the top here, I have 2 IV kits. These have 2 needles each and then a saline lock with them. I would not recommend getting these unless you're in a profession in which you actually are authorized to start IVs. I have these in my kit if I roll up on an accident or something in my county, in the county that I work in. My medical director covers almost all the services there, so I can save time for those services by starting an IV. But ultimately, any service, if you're outside your response area with people that you don't usually work with, they're probably going to discontinue your IV as soon as they get there anyways, so you're not saving them any time. And then also, there's nothing life-saving you're going to give in these IVs unless you carry around plasma or blood with you, which I highly, highly doubt. But I keep these in as just a time-saving measure. So 2 IV kits. These are both by North American Rescue. I like using them. They're pretty easy to use catheters. Some extra gauze, just some 4x4s in here for your minor wounds, scrapes, cuts, that kind of thing. In this pocket, in this top pocket, I've got a stethoscope and a blood pressure cuff. It's a good thing to do. If you've called for help, it's a thing to just keep you busy. It's a good thing to give to paramedics responding is a blood pressure, a whole set of vitals, listen to lung sounds, whatnot. Since I carry an ARS needle, I like having a stethoscope there to confirm a pneumothorax if possible. And then it's something to just occupy you until help can arrive, and it makes people feel comforted knowing you've been doing something. In this pocket here, I've got another pair of trauma shears, just because the ones on the outside have a habit of getting lost. In the back, I've got survival wrap, so it's basically like a foil blanket to keep somebody warm. Hypothermia kills in traumatic situations. You know, if you're in a car crash on the interstate in the middle of winter in Iowa, you can be in pretty bad shape. So I keep this in, and I'll keep this in through the summer as well, just because even a cool summer night can cause hypothermia in a trauma patient that's bled a lot. And that brings me to another point, is that clotting factors are disrupted if the patient is hypothermic or cold. So this is also helpful in bleeding control in cold conditions. I have a SAM splint, and we talked about these in my splinting video. Really versatile splint. You don't have a lot of room in here, so I like this because it saves a lot of space. 2 triangular bandages. I got these from North American Rescue. You can make these out of bed sheets. That's what we used to do on ski patrol, and it worked great. Keep these for a sling and a swath in conjunction with that SAM splint if there's an arm, a shoulder injury, whatnot. In this pocket, I have a Cyclone Bvm. It's kind of an off-brand actually, but works well. Bag valve mask device. Once again, not something you should carry unless you're specifically trained for it. You can get by with a rescue mask just fine. And AHA is recommending you don't do single-person bag mask respirations. Although I have enough experience with it, and most paramedics have enough experience with it, where if you get a good seal, you can give good respirations on your own with this. I carry a set of oral pharyngeal airways. You can carry nasal or oral. This is what I've had for a while. I do carry some nasal pharyngeal airways in my other kits, which are useful because these are really going to be put in somebody that's dead or very close to dead, where a nasal pharyngeal airway can be put into just about anybody. Those are the essentials that go in my kit. Now you're going to notice in my kit, and it's kind of a reoccurring theme throughout all my gear, is that there's not a lot of ALS supplies. I do have the IV catheters just to save some time, but other than that, everything's BLS, and that's because I'm preparing these for traumatic scenarios mainly, and there's not many medications that can be given that are going to actually make a difference in the survivability of somebody, and that's really what I'm concerned about as far as my first aid kit. On the ambulance, we concern ourselves a little bit more with patient comfort, but not necessarily in this case. The other thing to keep in mind is that it's a liability issue. Make sure you're protecting yourself and you're not practicing outside your scope of practice. The IVs that I'm going to be doing in the field are either going to be on close friends or family, or they're going to be in my jurisdiction to respond, so in my county in which I work, and I'm protected under my medical director. Once my third line gear arrives, I'll be moving this kit into my car full time and will not be using it for the ERT team. And then my third line gear will have some ALS supplies such as intubation equipment in it. But I still won't be using that for the general public if I stop at a car accident or something like that. If you think I forgot anything in this kit that you would pack in yours, let me know in the comments below. Like this video, subscribe if you'd like, and I will see you next week.